Good morning, everyone. Thank you for joining us today. Great to see you all here today. Sorry we're starting a few minutes late, but we're very excited to have you with us. So I'd like to welcome you all to our second workshop with Shema and Lena here at Our Voices School. Great to have you join with us, and we have an excellent speaker coming up for you. But before I introduce our speaker, I would love to introduce Paul Leonard, who is Chief of Staff, and also he is going to be the council member to Margaret Chin. And we want to welcome him here and also thank him for all of his work and commitment and support as he helped us with the Autism Initiative grant. So ladies and gentlemen, please put your hands together for Paul Leonard.
Hi, everyone. I just wanted to welcome all of you here today to discuss this important topic. It's a pleasure to be here in Councilmember Johnson's district, but the council member I work for, Margaret Chin, who represents Lower Manhattan, is very, very, very proud to support initiatives that help and help educate children with autism. I hope that this workshop is informative for you all, and I'm so happy to be here and to see all of your faces here ready to learn more about it and to share your stories together. Thank you so much for having me here. Thank you.
Thank you very much, Paul. All right, ladies and gentlemen, please could you welcome Alexa Moses to the stage, who is an occupational therapist, and today's topic is regulating children with autism. Alexa, please come on up to the stage.
Good morning, everyone. Thank you guys so much for all braving the cold to come out here today. We're going to be going through a number of topics today. All right. So the first thing we're going to talk about is our senses. We all know we have our 5 senses, the vision, sound, taste, smell, and touch, but we also have 2 internal senses. So what are these 2 extra internal senses? So we have proprioception, which is our sense of our body position. Proprioceptive receptors are located in the joints and ligaments, and they allow for motor control and posture. They are the body's awareness in space. The proprioceptive system tells the brain where the body is in relation to other objects and how to move in relation to those other objects. We also have the vestibular system, which is our sense of movement. The vestibular receptors are located in the inner ear, and they tell the brain where the body is in space by providing the information related to movement and head position. So it's through our senses that we make sense of the world. All right, so the role of sensation. We all know what things in our life make us feel happy, content, relaxed, and conversely, we also know what things in our life make us feel unhappy, overwhelmed, or on edge. This role of sensation is critical for the foundation of normal development, and it impacts everything that we do in our lives. Our gross motor skills, fine motor development, speech and language, social and emotional maturity, and behavior and learning. And sensory issues may be the root of these other problems. So for tactile, for example, you may have trouble localizing where an object has touched you, and as a result, your fine motor skills might suffer. You also, for proprioception, some children might love jumping, crashing activities, as well as deep pressure input that's provided by things like tight bear hugs. On the opposite side, you might have difficulty understanding where your body is in relation to others, and you might, again, bump into things or appear clumsy. And you might also have trouble sensing the amount of force provided. So these are children that you might see scribbling really, really hard with a crayon to the point where the crayon breaks, or somebody who's trying to erase very hard and they press so hard that the paper rips. For vestibular, some children crave fast spinning motions and intense movements, and they love being tossed in the air, jumping on furniture, that kind of thing. Conversely, you might see somebody who is afraid of movement. They don't have good balance, and they might appear clumsy riding a bike or climbing on playground equipment, balancing with one foot, that kind of thing. With taste, you might have a child who's a very picky eater when they're presented with unfamiliar foods or unfamiliar tastes. For visual, you may have visual perceptual skill issues, such as confusing the letters P and Q. And for auditory, you might have trouble with processing auditory sounds, and you might confuse words like ball and tall or doll, something like that. Okay, so sensory integration, I'm just going to give you a brief overview of it all. So this is a term that was coined by Dr. Jean Ayres in 1972. Dr. Ayres was an OT and a developmental psychologist who was known for her work in sensory integration dysfunction. Sensory integration is a neurological process that organizes sensation from one's own body and from the environment to then create adaptive responses. But it is able to be changed. The plasticity of the central nervous system allows for modifications to take place. And higher cortical processing functions rely on good processing and organization of sensory stimuli by lower brain centers. So we need to have these sensory systems in play before we can do higher level order things. So we're here today to talk about when things go wrong. So children with sensory processing issues usually have wild, intense, outsized emotional reactions to changes in the environment. These are giant shifts in the child's normal behavior. So for instance, you might have a first grader who may do fine in a quiet setting with a calm adult, but take that child to the grocery store and there's an overload of visual and auditory stimulation, and you might have the makings of an extreme tantrum. And it's terrifying for both the child and for the parent and others in the environment. The child's reaction might seem out of control. With tantruming, these kids' tantrums are so intense and so prolonged, it's impossible for them to stop once they've started. Basically, you can think of it as a traffic jam in your head of all these sensory inputs coming in from all different directions, and the brain's trying to make sense and process them, but everything's just jamming. Just getting hit from all directions and they can't make sense of it all. Another response that you might see in a child is the fight or flight response. Some children find it easier if they flee. If a child dashes out across a parking lot or a playground, it's obvious to them that they're in danger, and they may be heading away from something that's upsetting, which may not even be apparent to the rest of us, or they may be heading to a more calm environment, or to some sensation that will help to calm them. This fight or flight response is why some people with sensory difficulties might just shut down and escape the situation quickly, or they may become aggressive when in sensory overload. So they're actually having a neurological panic attack in a sense, and these are sensations that most of us take for granted every day. You also might have a child who's too fearful to play or interact with others, and interrupted sleep patterns. For self-regulation, a general definition of this is the child's ability to maintain regulated states of arousal in the face of changing environmental demands and challenges. So we have all these different parts of ourselves that can become dysregulated in many ways. So for example, with our physical self, this is things like our body function, movement, eating, sleeping, speech, movement. We also have our cognitive control, our executive functioning, such as focusing and attention, sensory processing, which we'll get more into later, emotional control. Ideally, we want to have a positive mood, have positive interactions with others, registering our emotions properly, and managing fight or flight responses. And then social interactions as well, interacting well with adults and peers. And we want all of these areas to be working well to be able to function most optimally. So this is our zone of good modulation. All of us want to stay within this box of being well modulated. If we go under or over, it becomes an issue. So all of these areas in the previous slide affect our zone levels, our energy, our mood, sensations, social interactions, movements, and reactivity. And all of us possess a certain threshold of tolerance for each sensory stimuli. And we can ID these various problems by dramatic shifts in the behaviors of children, as we just discussed. So where do sensory problems exist? Well, it's a symptom of autism because the majority of children And adults on the autism spectrum also have significant sensory issues. However, what's interesting to note is most children with sensory issues are not on the spectrum. Sensory processing issues occur in ADHD, OCD, and other developmental delays, or they might occur with no diagnosis at all. All right, so the prevalence of sensory modulation disorder. There's fewer behaviors in infants, but it is still visible. An example you might see is a child backpedaling away from irritation. As the child ages, there's an increase in symptoms, and by ages 6 to 9, you see the full-blown symptoms. After that, there's a slight decrease in symptoms because at age 9, abstract reasoning comes in and strategies start to happen. The child realizes, hey, this stuff isn't going away, so I'm going to have to figure out how to take care of myself and how to deal with these issues. Autism occurs about 1 in 68 children. It's 4.5 times more common among boys, and according to the CDC, the rate of autism is now stable. Sensory modulation disorder is not recognized as a medical condition in the DSM, which I thought was also interesting to note. Okay, so we're going to distinguish between sensory acuity and sensory processing. Sensory acuity is our physical ability of the sensory organs to receive input. So these are easy fixes. We get glasses, we get hearing aids. Sensory processing is the brain's ability to interpret the information we receive, and that's harder to fix, but it is possible because of the plasticity of the central nervous system. When the sensory system is modulated, the child organizes goal-directed actions, which we term adaptive responses. And these help the child to grow and develop, and they come from within the child. The child is an active doer and not a passive recipient. Okay. Oh, not sure what happened to my chart here. I had a chart that I really wanted to show you guys, but I'm not sure why it's not coming up on the PowerPoint. Any ideas, Lucy? Well, it would be good to have just to explain the other rest. If not, it's okay. Okay, we'll move on for now. Hopefully later we'll get a chance to look at the chart and it will help clarify things. But we're going to talk about self-regulation strategies and 4 basic patterns that we see, which are low registration, sensory seeking, sensory sensitivity, and sensory avoiding. And we're going to go through all these different strategies. I just wanted the chart to clarify, but it's okay if it's not available. Okay, so in talking about these, we need to clarify 2 main terms. So one is responsiveness, which refers to the way that we respond to the demands in our lives. So when your nervous system is responding too much, we term it hyper-responsive or over-responsive. And when your nervous system is responding too little, we call it hypo-responsive or under-responsive. We all have times when we are hyper-responsive or hypo-responsive. It's only when an extreme reaction interferes with everyday life that it becomes a problem. So there are many things that can affect your responsiveness, including the demands of an activity, the characteristics of your environment, or the way that a person's self-regulation strategies affect their daily life. Okay, we're also going to talk about threshold. So responsiveness and threshold are the 2 main terms to keep in mind. So threshold refers to the amount of sensation needed to be able to produce a response. So if you have a high threshold, you're having a low response to a specific or all sensory stimuli. And if you have a low threshold, you're having a high response to specific or all sensory stimuli. So you can think of it this way. Think of a large cup and a small cup. In the large cup, well, think of the cups as a sensory system, and the water that's going into the cups, or coffee, whatever you want to call it, is the sensory input you're receiving. So if you have a large cup and you're dripping water in, it's going to take a long time to fill it up, right? So this is the same thing with somebody who has a high threshold. They need a lot of input in order to reach that threshold. And the same thing goes for a small cup. If you're just pouring a little bit of water into a small cup, it doesn't take long before it's filled up. So that's the same thing as having a low threshold, where it doesn't take much for the child to become overstimulated. So a child who has a high threshold might bump into things they might not be aware when they get hurt, and they might not seem to hear well because they're missing a lot of what's going on. If you have a low threshold, you might appear agitated by a simple touch. You might cover your ears when a train goes by. Okay. So the self-regulation strategies, they are a range of behavioral responses to sensory input that reflect the child's self-regulation strategies, and they exist on a continuum. So at one end, you have passive self-regulation strategies. The person lets sensory events occur. It can mean that the person misses things, or they feel overtaken by things in their environment. So they might miss somebody's facial expressions. They might also notice everyone's checking their phones, and they therefore can't focus on a lecture, and they miss everything that happens. At the other end of the continuum, you have active strategies, where the person selects and engages in behaviors to control their own sensory experiences. And that can be either more input or less input. So for example, somebody might hum or whistle to add sensory input to keep their attention in a game, or they might move to a quiet room as a means of controlling the amount of auditory input and therefore to increase their concentration. So they can be useful and helpful to a person, or they can interfere with a person's ability to participate in their daily life. Okay, so I would love to show you the chart to make more sense of it, but we'll try to keep as organized as we can. So the first sensory strategy is low registration. So it's characterized by high sensory thresholds and a passive self-regulation strategy. So these children notice sensory input much less than other people do. They might seem uninterested or self-absorbed or even dull at times. They don't notice what's going on around them, and they might miss cues that might influence their behaviors. Interventions are directed at increasing the intensity of sensory input to improve the likelihood of noticing and responding to environmental demands. Okay, then we have sensation seeking, which is characterized by high sensory thresholds. Again, so they're needing a lot of input to get to that level. And they have an active response, an active self-regulation strategy. So they enjoy and generate extra sensory input for themselves. They're very active, they're continuously engaging and excitable as a means to meet these high thresholds. Sensation seeking becomes a problem when seeking behaviors keep the person from continuing in a desired activity. And interventions are directed at providing more opportunities for the desired sensory input within daily life. We also have sensory sensitivity. So this is on the opposite end, where they have low thresholds and a passive self-regulation strategy. So they don't need much to reach that threshold. They detect input more than others. They're more distractible, hyperactive, and they can be complainers. So they notice many more sensory events than other people do, and they allow things to happen to them and comment on them rather than remove themselves. And interventions for these guys are directed at providing more structured input so that the person does not become overwhelmed in their daily life. Then we also have sensory avoiding. So these people who are sensory avoiding have low sensory thresholds and an active self-regulation. So again, they're bothered by input more than other people, but they're rule-bound, ritualistic-driven, and uncooperative because of these ritualistic behaviors that limit the amount of unfamiliar input. So they remove themselves, unlike their sensory sensitivity counterparts, and they limit the sensory input that they are required to deal with. Interventions are directed at making input less available so that the person does not become overwhelmed and want to withdraw from participation in their daily life. Okay, in addition to these patterns of sensory processing, you also have to consider the response of each sensory system. So you probably won't have the same response with each sensory system. For example, you might be sensitive to vision or touch, but you might not notice sounds at all. So although we might identify with one pattern of sensory processing, the truth is that each of us have a certain amount of each pattern of sensory processing. So you might primarily be a sensation seeker. You might love roller coasters and anything with a lot of movement. And you might also have some sensitivity to certain sensations. So for example, you might be very sensitive to sounds or to taste. And you have to understand your own patterns in order to get the most help. So if you think that a child you see, or maybe you're the parent of a child who might have some sensory issues, what are the beginning steps to ID your child? Well, you have to figure out what are the reasons for the evaluation. What behaviors am I seeing? You're going to want to have a parent, teacher, and child interview to discuss these issues. Fill out a sensory history, which is a sensory profile, which we'll discuss in a minute. Skilled observation of activity performance. You're going to look at the ability to organize sensation for use, how the child adapts to changing physical and social environmental conditions, and how the child makes adaptive responses. And once they have been identified, early identification and intervention is important to treating these behaviors, because again, the central nervous system has plasticity and is able to be changed. So a sensory profile is one of a few different assessments that you can do, but it's kind of a good beginning step. There are two different versions of the sensory profile. There is one for infant toddlers and one for adolescents and adults. So the infant toddler sensory profile, the focus is to measure reactions to daily sensory experiences. It is a questionnaire that's filled out by a caregiver using their judgment and observations of a child's sensory processing, modulation, and behavior and emotional responses to each sensory system. And the population that this serves is infants and toddlers from birth to 36 months. For the adolescent and adult sensory profile, the focus is that it allows the clients to identify their personal behavioral responses and develop strategies for enhanced participation. And the method is, again, a questionnaire that measures the individual's reactions to daily sensory experiences. So you can actually fill it out yourself. And the population for this is individuals who are 11 to 65 years old. So what's next? So once you have completed these steps, when problems are found in sensory-related screens, a more comprehensive occupational therapy evaluation should take place. And children who are diagnosed with sensory processing disorder will then receive occupational therapy services to enable them to better modulate their sensory information. Some of the benefits of receiving occupational therapy in sensory processing disorder is that it improves the overall ADL skills of the child. Gross and fine motor skills improve, cognitive language and academics improve. There's an increase in frequency or duration, and they're able to have more adaptive responses, and an increase in self-esteem and self-confidence. So we're going to watch a short clip of what it's like to experience sensory overload. This is a clip that has been passed around a lot on social media, so some of you may have seen it before. It's from the National Autism Society, and I think it's a really good look into the eyes of a child who has some type of sensory processing issue and is having that neurological panic attack where they're just being overrun by sensory stimuli. I will give you a warning that there's a lot of bright lights and flashing, so if anyone who feels that that might be a lot for them, feel free to step out or close your eyes, whatever you feel like you need to do. Okay, let's see if I can copy and paste this. Let's see. Oh, maybe here. Oh. Oh, here we go. Okay. Let's see if we can load this. Okay.
7, 8, 9. Take my hand. I'm not naughty. I'm autistic. And I just get too much information.
So I thought that's a very good clip for kind of understanding what some of these kids go through. Thanks. Thank you. All right. All right, so now we're going to talk about some sensory strategies. These are strategies to kind of help our children who are maybe needing something to do with their hands, and just different sensory strategies to help modulate their systems. So we're first going to talk about fidgets. Some good fidgets out there are rabbit's foot, cush or squish stress balls, tangles, theraputty, kaleidoscope, and ponytail braids. So these are just kind of good for keeping the hands busy. We have a lot of kids that stim with their hands. You might see, behaviors like this, or interlocking of the fingers, or bending straws, or things that are not really appropriate. So these are some better strategies for dealing with children that require a lot of input from their hands. Also, there's movement and heavy work input. So weighted vest, lap weight or log rolling, using a therapy ball or a weighted ball, climbing on the monkey bars, giving yourself a big squeeze, performing a wall push-up, getting deep pressure input from a ball or a pillow, and yoga walks and animal walks. And there's probably 100 more things, but these are just some examples to start with. For vision, LED lighting is beneficial in reducing the amount of clutter. Carnegie Mellon actually did a study where they took children who were typical functioning in a classroom, and they gave them a test. And in the classroom, they had a lot of stuff on the walls, like a typical classroom, just very bright, everything to look at. And they gave another assessment where there was nothing on the walls. And they found that in typical functioning children, they did better on the assessment when there was very little visual input on the walls. So the same is even more so for our children on the spectrum who have these sensory processing disorders. For hearing sensitivities, warning for alarms is a good idea, using earmuffs or plugs, and sound tiles for noise reductions. The only thing is with hearing, you want to be careful because you can easily get an ear infection from things like earmuffs or earplugs rather, because they're going straight into your ear. So you just have to be careful of these things. Okay, we also have what's called a sensory diet. It has nothing to do with food, which is a common misconception whenever I tell someone who isn't familiar with sensory diet. It's a carefully designed and personalized schedule of sensory activities that help to give a child the sensory input that they need to better handle the activities of daily living. And ultimately, it's going to help your child function well at school and at home. With the use of a sensory diet, you can retrain the brain to process sensory information in a more typical way, and it's individualized to meet specific needs. So just like you or I might jiggle your knee, or you might tap your foot while you're waiting in line, or you might find that you need to take a hot bath at the end of the day to kind of calm down and unwind. Children with sensory processing disorder, they need to engage in these type of activities as well. But they need more to help them stay self-regulated, and so that they can handle the sensory input everywhere they go. Okay, so generally a child who is hyperactive needs a lot of movement and stimulation that includes heavy work, as well as other sensory experiences to help him or her arrive back at a calm state and more focused state. A child who is commonly a sensory avoider and who's underactive may be overwhelmed by stressful sensory input, and he or she may also need calming and focusing input as well as a break from the distressing sensory input. So a pediatric occupational therapist who is trained and skilled in working with a child with sensory issues can observe, evaluate, and work with your child to customize a specific sensory diet. But as an OT, you only end up seeing a child 2 or 3 times a week, so it's really up to the teachers and to the parents to implement the sensory diet. because it's not going to be effective if it's only done when they're in an occupational therapy session and it's not carried over outside of that. You also need to be the ones who are alert of signs that maybe the sensory diet needs modifying because the child is not functioning well, they're not tolerating certain things. So there needs to be that communication too between the therapist and the teacher and the parents. The effects of the sensory diet are immediate and cumulative. They're not only cumulative and effective in the moment, but they can, again, restructure the nervous system over time so that the child can tolerate sensations in situations that are challenging, regulate alertness and increase attention span, limit sensory seeking and avoiding behaviors, and handle transitions better. I've designed a number of sensory diets for a few of my students at Shema, Kolainu, and the amount of attention now and focusing and just toleration overall of sensory input has really been effective because people have really followed through. You have the commitment from the parents and the teachers, and everyone's really doing their part to ensure that this child's sensory needs are really being met so they can function most optimally. One of the trickiest aspects of sensory processing disorder is recognizing when a child is underactive or overactive, and then how to adjust the sensory input so the child doesn't experience that sensory overload, similar to the video we just watched. So we want to provide the child with what we term the just right challenge to get the child out of their comfort zone and participate in sensory activities that are helpful without pushing them too hard. So what we call it in OT is grading the challenge, where you're giving them just the right amount of just pushing them a little bit so that they're uncomfortable, but you're not making it to the point where they're shutting down, or you're not making it too easy. Sometimes also children are willing to try these different experiences with someone other than a parent. So sometimes it is helpful to have the OT or someone other than the parent coaxing them. A lot of times on a sensory diet, you will find the Willebarger protocol, which is a brushing protocol. Some of you might be familiar with it. It's brushing using a surgical brush, and there's a specific sequence to how to do it. It helps reduce strong sensitivities and helps with regulation. There's not a lot of evidence at the moment to support the Willebarger protocol, but people who have done it have found that it's very effective. And if it is done, it's done on a 2-hour interval, and you must have special training in order to do this. So you're going to provide firm pressure through a brush, and it tends to be very calming, and you don't want to do any light touch, so don't worry about pressing too hard. The bristles are very soft. And you want to avoid the face, palm, and abdomen because they're particularly sensitive to light touch. And you're going to apply it in the direction of hair growth, and it's followed by joint compressions. So the whole thing in total should probably take 2 minutes. It's usually the time it takes to play a nursery rhyme to keep the child interested. Arms and legs, the back also, yeah. Some people want to do the bottom of the feet as well, but you don't want to do it in an area that's particularly ticklish for the child because they should be getting the input. So some contraindications are not to brush babies younger than 4 months. You want to avoid light touch. Do not brush on eczema and rashes. Do not brush on the stomach or the chest because the child could have severe systemic reactions. They might vomit. If your child is not tolerating the brushing, don't force it. One of the primary ideas behind sensory integration is that it's child-driven and child-led. And the last one is do not let the child brush him or herself unless they are old enough and competent enough and they have the training with a specific technique in order to do it on themselves. Okay, everyone can benefit from sensory experiences. There is a lot of research supporting the benefits of sensory-rich environments for animals, and the same is thought to be true for children. In May last year, I got to take a trip to the Perkins School for the Blind, and I saw some things there which I thought were particularly relevant to the population that I work with at Shema Kolainu. So one of the things that they had was a little room, which, again, the picture is not coming up. I'm not sure why. But it's basically a box where all the children at the Perkins School for the Blind have visual impairment, and this is kind of a way for them to explore their sensory systems tactilely and auditorily, and they lay in this box, which is They have things dangling from the ceiling, and there are buttons you can press that make noise, and the child gets to kind of explore their environment through auditory and through touch. And I thought that was pretty interesting and something we can even incorporate for our children at home if we wanted to make a box or something similar. And I also got the opportunity to create a tactile board, which my kids love. It's just a board with a bunch of different textures, and it's good for children who are maybe sensory avoiding to get them to touch and interact with different textures. And kids kind of gravitate towards this purple one here. It's very soft, I love it. But it's great to kind of expose them to a lot of new textures. You can make your own at home. Some people have it under the desk. It's very calming also for the children. You can kind of put whatever textures in there that you want. So if your child is maybe aversive to something, it's kind of a good way to expose them to it without them being overwhelmed. So feel free to come up and check this out after the presentation's over. Okay, so there's been a lot of research that shows that multisensory interventions are more effective than single sensory interventions, and they're better at affecting functional skills and behavioral characteristics of autism spectrum disorder. So you want to try to incorporate multisensory interventions into daily routines, about 90 minutes a week or so. So some tips for good sensory therapy. You want to create opportunities to experience. So you want to try to plug sensory interventions into the day. Again, the driving force behind sensory integration is that it's child-driven. So you want to collaborate with the child on activity choices. Give them the control. You want to make activities fun and engaging as much as possible. And ideally, you should have a range of sensory activities, so tactile, vestibular, proprioceptive, etc. Again, we're talking about the just right challenge for the child, and you want to modify the activities to ensure that the child is able to be successful. Guide self-organization, so you're going to give them choices and plan. Support optimal arousal. Ideally, the child should be at a calm and alert state. Ensure physical safety, goes without saying. And you want to arrange the room to engage the child. So simple environments, just as we said for the visual input. And foster a therapeutic alliance, which again goes without saying. Okay, so now we're going to switch gears and talk about this very cool study that was done using the environmental enrichment protocol. So what it is, it's a 6-month program designed for children with autism, and it was created by M. Leon, who originally used it as a therapy for animals. There were 2 studies that were done on children with autism, and the objective was to help children adjust to environmental sensations. One of the positives of it was it's very low cost, and it took place everywhere, home, school, early intervention, and it's really quick, 15 to 30 minutes 2 times a day, that's it. And what it does is it provides multisensory enrichment and then a few additional optional activities as well. So the aim of the environmental enrichment protocol was to decrease the severity of autism in ages 3 to 12. And 1 in 5 boys ages 3 to 6 actually lost their label of having autism. There was an increase in receptive language and an increase in IQ and an increase in sensory skills overall. Some things it misses were expressive language, movement, and emotions, and the study didn't look at girls at all. So there are 2 different studies that were done. One was the original protocol, which was the long version. So the children who participated in this performed 4 to 7 of 34 prescribed activities twice a day, each day, for 15 to 30 minutes at a time. And they did these for 2 weeks, and then they switched to the next set of activities. And they did them in the AM and PM. And this is kind of how it went as they went through the protocol. So in addition to following the activities, they also listened to classical music for 15 minutes over headphones, and they smelled natural scents while receiving a 1-minute back rub 4 times a day, and they slept with a scented cotton ball in the pillowcase. So these were the optional additional activities. Okay, so the first study was comprised of children ages 3 to 12 who had a diagnosis of autism spectrum disorder. 28 boys were recruited. They were receiving standard treatments of ABA therapy, OT, speech, social skills training, and adapted PT. So some of the rules of participation, they could not have any psychotropic meds. no new behavior programs, Ayers sensory integration, or therapy with a physical restraint. And they were randomly assigned to one of two groups. So the standard treatment, they were the control group. They did not receive the intervention, and the full treatment, 15 of them did receive the treatment. So they looked at the start and end of the study, the lighter R for cognitive, the autism diagnostic observation schedule, the childhood autism rating scales before and after, and the expressive one-word picture vocabulary test. And the results were that there was a strong effect independent of age. And for these children, there was an increase in cognition and a decrease in autism severity. But a lot of people felt that the protocol was just too long. So they opted for a shorter version. So again, in the shorter version, they performed 4 to 7 prescribed of the 15 activities. So they cut it in more than in half. They cut it down a lot. And they had sensory experiences twice a day, again, for 15 to 30 minutes at a time. The scent was optional, but parents who did it found that their child was able to stay calmer during the day, and they slept better at night. And the music was also optional, but children who did it found it very enjoyable. So in the second study, the children were ages 3 to 6, and again diagnosed with autism. 97 were recruited and 91 accepted. 50 actually completed. Dropouts were due to time, personal issues, and new therapy. A lot of these children that dropped out were newly diagnosed, and they just felt that the study took too much time. So they were again randomly assigned to the standard care, and then they were broken into the full treatment, who got the long versions, and the short partial treatment, which was the shorter version. And they also sorted them into 2 different blocks of low severity and higher severity. So they wanted to see, is there a difference in how these kids are affected. Okay, so again, they looked at the lighter R at the beginning and end of the study, the ADOS, and they changed the language test. So they used the Raynell Developmental Language Scale and a short sensory profile. So again, the rules were no psychotropic meds, no new behavior programs, no Ayers sensory integration, or therapy with the physical restraint. So the results was that environmental enrichment protocol was very effective. The full and partial treatment groups, the long or the short versions, were not significantly different. So it didn't matter if you did all 34 of the activities or you just stuck to the 15 for the shorter version. There was a medium-sized effect on the lighter, the short sensory profile, and the Raynell receptive language. 1 in 5 actually lost their label, and they fell off that cutoff. So these were higher functioning children that then lost their label because of the intervention. The higher the initial lighter and Raynell scores, the higher the odds of falling off the label, which makes sense. And there was no correlation between age and outcome. So this is the environmental enrichment protocol. I understand it's very small, so hopefully you guys will get a chance to take a look at it later. But it's just a set of a few different activities. I'll give you a few examples here. So number 1 says the child puts their hands or feet in water of different temperatures. And number 2 says the child squeezes objects of different shapes and textures. So they're doing a lot of these like multisensory type of interventions simultaneously. And again, there's 4 to 7 of these done, 15 to 30 minutes, 2 times a day, and that's it. And I've started to incorporate some of this into my own treatment sessions, and some of the teachers have done this as well. So I had a child who enjoyed playing with little water beads, and I gave him in 2 different bowls of different temperatures, so he's getting that input for temperature regulation as well as for the tactile stimulation as well. All right, so each enrichment has at least 2 sensory components such as touch and visual, or motor and hot and cold. You're going to use the activities in the order given because they're ranked from easiest to hardest. And again, you're going to want to try to grade the challenge to make it the most optimal challenge for each individual. Plan to spend 2 to 4 minutes on each activity and come back later to the items that the child was not able to do, and use common sense. Okay, so again, we're going to switch gears and talking about incorporating sensory experiences during the day, how to make that possible. So at bath time, you're going to want to use a washcloth or a bath brush, and to scrub with that, and try a variety of soaps and lotions. For bathing, a lot of children really enjoy playing on the wall of the bathtub with bathing foam or shaving cream. You can rub lotion on your child after bath time to give them a deep massage for that deep pressure input. Sprinkle powder onto the body and brush or rub it onto the skin. For meal preparation or baking, you want to get your child as involved as possible so they can mix the ingredients, which is good heavy work, and they really help strengthen their muscles. You can let the child roll or push dough. Allow your child to carry heavy pots and pans, bowls or with water or other ingredients, with supervision, of course. Let them tenderize the meat, with a mallet or whatever you need. Done. For grocery shopping, have your child push a heavy cart as long as the weight is within their capacity. The child can also help carry groceries or help put them away. For mealtime, you're going to want to encourage them to eat chewy foods, drinking out of a straw. Try having your child sit on an air cushion to allow some movement, and a weighted lap blanket might be very helpful as well to give that heavy work input. Household chores, allow the child to help with vacuuming or moving furniture. Let the child carry a laundry basket or detergent, and in gardening they can help dig or landscape, that kind of thing. So you're going to want to try to get your child involved as much as possible to have these sensory experiences throughout the day that will in turn help them reach that optimal state of arousal. At playtime, reading books in a rocking chair so they're receiving vestibular input, or on a beanbag might be beneficial. You can make an obstacle course with your child in the yard or in your house. They can crawl, jump, do different walks, hopping, skipping, rolling, whatever the child is into. Playing soft music is very calming. You can play the sandwich game where the child lies between two pillows and you squish them in the middle. If you're the sandwich, then they're the meat, or whatever you want to call it. Ask them if you want them to do it harder or softer. And some children would like a lot of pressure, as you would expect. You can also go around your neighborhood in a wagon, have them pull a younger sibling or maybe something heavy. You can also do the same with a baby doll carriage, have them push the baby in the carriage or pull the baby. Swimming is really good also if you have that available, and horseback riding and bowling. Mini or full-size trampolines are good for providing sensory input as well. You just have to make sure your child is using it safely, so of course supervise. And sandboxes that contain beans or rice, popcorn kernels, they're really fun also, so a lot of play boxes, and they're kind of easy to transport too. You can add little manipulatives into them as well. You can add small cars or animals, and that also will encourage your child to interact with the texture more if they see something that they like inside of it. With errands and appointments, before visiting the dentist or the hairdresser, you could try massaging your child's head if they tolerate it, or having your child wear a weighted hat. Try chewy foods or vibration in the mouth with an electric toothbrush, and let your child wear a heavy backpack. Of course, you have to make sure that the weight is appropriate. Be sure to give the child ample warning before changes in routine or any unscheduled trips or errands. Many children who have sensory processing issues, they need that time to kind of process the information, and they are used to predictability, so any changes in routine might really throw them off. So some tips for the home: we want to keep routines and items organized as possible. Be consistent with the rules. Keep an activity schedule or calendar posted and stick to it when possible. Discuss upcoming anticipated changes in routines at a point in time that is beneficial for your child. If you know your child needs to be told, 2 hours before that they're going to the dentist, let them know 2 hours. If they aren't going to need to be told till 10 minutes, let them know in 10 minutes. You have to experience with each child when they need to be told what's best for each person. Use your child's sensory preferences indirectly for fun rewards to handle behavior. So, for example, if your child works towards an extra trip to go bowling or horseback riding, but you don't want to restrict movement activities when your child is being disciplined. For example, taking away a trip to the playground because the child was not able to sit appropriately at the dinner table. So that might not be the most effective way in dealing with these issues. Your child might need movement at that time, and removing it might actually make the behavior worse in the end. So tactile defensiveness. For those of you who might not know what it is, it's an overwhelming irritation and discomfort from ordinary sensations such as light touch of a person, certain textures of clothing, brushing hair, etc. So everyone take a moment to picture in your head something that you just can't imagine touching. For me, it's spiders. I cannot imagine touching a spider. So that's what it's like for these children. Even, let's say somebody was very tactile aversive, and I'm having them touch this purple mesh right here, it would be like for me touching 100 spiders. Like I can, it gives me goosebumps, So everyone has their own individual things that they are tactily aversive to. Or it might not be tactile, it might be auditory or something else, but it only is, again, when these are interfering with daily life that it becomes a problem. So the child may present with anxiety, anger, fear, and emotional distress, among other reactions. Self-care activities are usually affected as a result. So identifying aversive textures and adapting the environment to avoid threatening the child is most beneficial. And then we have desensitization, because ideally we would like the children to interact with multiple textures, but we don't want to overwhelm them. So we're never going to force a child to touch something that they absolutely can't stand. You want to slowly build the skills with the just right challenge. So you're going to start out very easy. Don't overwhelm the child, just a little bit at a time. Slowly increase the challenge over time. You can have the child slowly build their skills. I have one child that I see at Shema, Kolainu who absolutely hated touching many things. So one was rice for him, and he would start out the sight of the rice box. If I took it out, he would freak out. That would be it. I had to put it away. So we started just bringing it out slowly, and then over time I took out little kernels of rice and had him pick them up one by one, and you'd see him pick up each kernel, put it in the box, and then wipe his hands off immediately, and you'd see it all over his face just how awful it was for him. But then through gradual exposure we kept doing it. And then you started seeing him using more than just the 2 fingers, and then slowly his whole hand, and now he plays with the whole box. He'll put his whole hand in, and it's really amazing how it really works. But it takes a long time. For most children, it's not an overnight thing where you're going to fix the tactile aversion just like that. But frequency of interventions is important. Regular exposure at least 2 times a week, and several times each day when possible. And you want to keep the activities fun and functional. So maybe you want to get the child involved in cooking if they hate wet textures and they're helping, to wash something or something like that. Gradual exposure in children with tactile defensiveness. So we're going to talk about intolerance of sunscreen and lotion. So there was a case study that was done by an ABA therapist in Texas. Her name was Ellen Ellis. It involved 2 children with tactile defensiveness towards sunscreen lotion. And she found that through shaping behaviors with a reward, they were able to eventually put on the sunscreen. And again, it must be done often and gradually for a success to occur. For the first child, it only took 14 days, and for the second child, it took 10 days. So how it worked was like this. So step 1 was just holding the bottle of lotion. Then she had the child put the lotion on the therapist's palm. Next, she had the child put lotion on the therapist's nose using her finger. And then there was a series of other activities that took place. By step 5, she had to dab the lotion on the child's hand, count to 3, and then wipe it off. And then a very small dab on the child's hand, and this time rub it in. And then by step 17, it was you do it yourself. And then she generalized that experience of putting on the lotion to use in the bathroom. And by the end of it, both children actually, were able to put on the sunscreen lotion. So some other interventions, self-applied stimuli are more tolerable than passive tactile application. The more inner-directed the child's activity is, the greater potential to improve neural organization. Controlled sensory input can be used to elicit an adaptive response. And registration of meaningful sensory input is necessary before an adaptive response can take place. For sound desensitization, using a voice memo app on the phone, if you go to settings, there's a way to record different sounds on your phone. And you can start with common sounds for the child, like water running, mouth noises, walking, and just slowly build it up to low tolerance sounds like chewing, alarms, squeaks, and you're letting the child have control. So they're the ones who are pressing that play button to hear the sounds that they might find extremely upsetting for them. And you can make it fun too. You can make games or social stories out of it too. I had a boy who absolutely freaked out every time the alarm rang for a fire drill, to the point where he was just in a panic mode and couldn't get out the door. So I recorded some of these sounds of alarms on my phone, and he played them at a low volume, and we built it up slowly to the point where he was able to then transition to go outside and not be overwhelmed by the sound of the alarm. Anyone have any questions? Sure.
So you said that the sensory profile comes in 2 ages.
Yes.
So 0 to 36 and then 11 to 65.
Correct.
What do you use in that in-between area, 3 to 11?
There's a number of other assessments. The sensory profile is just one of many. So you could use any of those other different assessments to kind of identify the sensory issues.
Because I'm a PT and I have a specific case where it's a lot of oral, and I don't know if it's aversions, if there's aversions to teeth brushing, aversions to food. Like his diet is very, very limited.
Okay.
But then he takes everything and puts it in his mouth. So I don't understand what to do in that situation because, I mean, eraser bits, caulking, like anything, like he can put in his mouth, he'll put it in. But then he doesn't want to brush his teeth and he doesn't want to eat anything. So I don't know what to do with him.
I have a lot of children that have similar issues, and we're working on brushing teeth with them as well. Have they ever tried using a Z-Vibe or anything to kind of stimulate the mouth at all?
I don't think so. At home, at least, I'm pretty sure that they haven't. But I know mom's expressed to me, her frustrations with both, teeth brushing and eating.
Sure. Yeah. And have they tried any like chewy or crunchy foods, or it's just mouthing those inanimate
It's
objects?
very limited to like a cake
Mm-hmm.
and just milk. And that's as far as I know. Sometimes they might eat a little bit of like meatballs, and that's really all that this child would eat. But like I said, he reaches for textures that are like the eraser bits. They're
Mm-hmm.
chewy, they're small. He does, rub his tongue down.
Right. So I have a lot of children that have similar issues with that as well. So the Z-Vibe is definitely beneficial because it's giving them that vibration. It's called a Z-Vibe. It's like a tool that goes. It's a vibrating tool that goes inside your mouth, and it's kind of similar to a vibrating toothbrush. It kind of has the same effect. So maybe starting with something like that, or introducing chewy or crunchy foods, and just kind of having the child try to distinguish between foods that are edible and things that are not. And
Is there a protocol for the Z-Vibe?
no, it's kind of whatever the child is comfortable with. Some of the children might not let you put it in their mouth to begin with, so I would start around the mouth, cheeks, lips, chin, just kind of getting them used to that whole general area before attempting to go inside the mouth, which might be more aversive. And also they might want to think about a feeding therapist coming to the house if they're only eating certain foods, or maybe talk to the speech therapist as well. They might have some other suggestions for that. Any other questions? We'll go with you in the back.
run away from it. Now he's just like, he'll look at it and just, it'll take him a little bit more time. But he's actually, trying different things because I try to reward him when he tries something different. So maybe speaking to the mother, to the parents, and see, what is it that they enjoy, they like to do, and just give them the option that, hey, how about you try this? You can, do this a little longer, or, you can get this, pack or something that they would, prefer to eat, as opposed to just looking at whatever particular item you try to give them a moment.
Perfect. Thank you for your suggestion. You had a question in the back?
You mentioned on a couple of slides about neural changes in the nervous system. Can you speak a little bit more to that? Like what types of changes occur? How long does it take to see changes?
Sure. The amount of change that takes place, it really varies depending on the child, and it's hard to say a specific timeline for it because, again, it's depending on the amount of exposure and just overall the child, everyone's different. So for some children, they might take 14 days to be able to put on the sunscreen. For other children, it might take a whole year. But what I was saying about the central nervous system is that it has the ability to form new connections, to kind of be rewired, to switch itself so that it doesn't have the same amount of negative sensations that are the response to a lot of these sensory input. So the more that the child is exposed to it and the more interactions that they have that are positive, the quicker the change will take place. Does that make sense? You had a question?
I just wanted to share on the feeding part.
Sure.
And we have a very good feeding program as a parent who are the program is intensive, and it does require parent participation, and they also allow staff from the school to also come and see how they're working with individuals also.
Great. Thank you guys all so much for being here today and for coming out in the cold. If anyone would like to take a look at the tactile board, feel free to come up here after the presentation, or if you have any questions, I'll stick around for a little bit. All right, thank you all again.
Thank you so much, Alexa, and thank you all for joining us today. I just want to do a few quick announcements. So our next workshop is also going to be complimentary. It's on January 31st. It will be with Dr. Stephen Shaw, and the topic will be an inside view to autism, a sensory experimental sector. So that'll be on January 31st. You can register for the workshop. It is already available. And before you leave, I'd like to show you all a very short video that our children at Shema actually helped us create over the last month. It takes 1 minute, so I'd like to share it all with you. So if you just bear with me, and we will start that.
One in 68 children is now identified with an autism spectrum disorder. However, the diagnosis means something different to each family and child affected by it. Shema Kolainu is a school that helps voices be heard and creates a safe environment for children to develop, grow, and learn.
And when I've seen that kids with difficulties that have problem learning, I just want to help them.
Every day I learn something new. Without our teachers, we won't be smart. And with our teachers, we'll be smarter than ever. Help us. Help us help our school.
It takes a village to support children, a village that is constantly underfunded.
So thank you all for joining us. This is a complimentary workshop, and we want to continue making these workshops complimentary so that you can all enjoy. So the only thing that I ask of you is to be able to share that video with your friends and family and help us continue our journey at Shema Kolainu. So you can find that that video on our website, and just share with your friends and family, and we hope to see you all at the next workshop on January 31st. Thank you again, and thank you, Alexa.